AI image generators have spent the last few years mastering digital art. Now, one of the biggest players in the space is pivoting to something entirely physical, mapping human tissue. This is David Holz, CEO of Midjourney. He announced a new division called Midjourney Medical, aiming to build a liquid immersion, whole-body ultrasound scanner. Because Midjourney is entirely bootstrapped and generated roughly $200 million in subscription revenue last year alone, they have a rare luxury. They can fund highly speculative, capital-intensive hardware experiments entirely out of pocket without having to answer to venture capitalists. Holz brought in Ahmad Abbas, a physical hardware expert who spent 5 years as an engineering manager on Apple's Vision Pro spatial computing headset. The announcement immediately divided the internet. Silicon Valley founders and billionaires like Elon Musk hyped the project as an exciting engineering leap. Meanwhile, actual radiologists and medical physicists pointed out some severe clinical roadblocks. This leaves us with two major questions. How does a water-based ultrasound machine of this scale physically work? And how does an AI software company plan to legally operate it outside of a hospital? As we'll see, Midjourney's long-term plan is to bypass the traditional medical establishment entirely to start collecting raw biological data. The current prototype is a vertical, open scanning tank. You step onto a platform surrounded by a pool of water, which then lowers your body through a stationary 70-centimeter ring at a rate of about 2 inches per second. Traditional clinical ultrasounds rely on messy, localized gels to transfer acoustic waves into the skin. In this system, the deep pool of water acts as a continuous coupling medium for the entire body. Let's look at the ring itself. The hardware is lined with 40 solid-state imaging chips, providing exactly 358,000 microscopic active ultrasound sensors. Each one of those tiny elements acts as a transceiver. They are simultaneously firing high-frequency sound waves and listening for the acoustic reflections bouncing off your internal anatomy from hundreds of different angles. Capturing that much raw acoustic telemetry generates a massive data bottleneck. The machine pulls in about 17 gigabytes of waveform data every single second. Even with an on-device server cluster delivering over 2 petaflops of computing power, a single multi-slice scan takes roughly 20 minutes to complete. Midjourney has clearly proven they can engineer the hardware to capture a massive flood of telemetry. But turning those sound waves into clear images means confronting a rigid law of physics. Sound waves behave predictably until they hit a boundary between two materials with vastly different densities. Physicists call this an acoustic impedance mismatch. When an ultrasound wave strikes dense bone, like your ribs or your skull, roughly 40% of the acoustic energy instantly bounces backward. Only a fractured, weak signal actually penetrates through to the other side. The problem is even worse when sound hits air. If a wave hits the gas in your lungs or your digestive tract, 99.9% of the acoustic energy is reflected. This creates massive acoustic. To correct for all these distorted reflections, Midjourney's engineers are pointing to a highly complex mathematical technique called full waveform inversion, originally used in geophysics to map underground oil reservoirs. Trying to use an incredibly dense equation to computationally correct physical wave distortions inside a living human body is largely unproven. And that technical hurdle makes securing traditional medical clearance highly difficult. Major medical organizations and public health experts actually advise against whole-body screening for healthy, asymptomatic individuals. The primary reason is the high rate of incidentalomas, harmless, benign biological quirks that almost everyone has. Spotting these anomalies often triggers a cascade of expensive, anxious, and highly invasive follow-up procedures, like surgical biopsies, to investigate something that was never going to harm you. Because of these risks, clinical imaging devices like standard enclosed MRI machines must operate inside highly regulated hospital procurement networks. So Midjourney is attempting a deliberate regulatory sidestep. At launch, they won't market this device as a medical diagnostic tool. Instead, the machine will output non-diagnostic body composition maps, tracking your muscle mass, your fat distribution, and bone density, meaning they don't need prior FDA clearance to turn it on. The company plans to deploy these unregulated scanners directly to consumers inside a flagship high-end wellness spa in San Francisco, placing the 20-minute imaging chambers right next to traditional saunas and cold plunges. This chart shows exactly why a subscription AI company wants to run a high-end spa. By getting healthy people to routinely step into the scanner, Midjourney can collect a continuous, weekly stream of sub-millimeter anatomical data over time. The wellness spa is an indirect distribution model. Midjourney is using a consumer hospitality loop to quietly harvest a massive 3D biological dataset, aiming to do to physical anatomy what they already did to digital imagery.